Hello, my name is Dr. Farman Ali and I'm a GP, family physician. Medication for blood pressure. There are 5 main classes of medication that are used to lower the blood pressure. They are called the angiotensin converting enzyme inhibitors. Number 2, calcium channel blockers. The third one is water tablets or diuretics. These include both the thiazide type diuretics and spironolactone. The fourth one are the alpha and beta blockers. The fifth, more complex one, they are called the centrally acting antihypertensive medications. The choice of medication, it depends on many different factors. If you have an underlying health problems, you might be started on certain tablets. If you are of a certain ethnic origin, such as Afro-Caribbean origin, you might be started on a different type of medication to start with. Whether you take any other medications, potential side effects from certain medications might dictate the choice. Hypertension with diabetes require treatment with ACE inhibitors or ARBs as they are called. They are indicated in the top left-hand corner of the diagram. Those without diabetes fall into 2 categories: those under the age of 55 and those over the age of 55. Patients under the age of 55 are started on ACE inhibitors or ARBs, while those above the age of 55 are started on calcium channel blockers. Patients who are from the Afro-Caribbean origin may be started on calcium channel blockers. If a second drug is required, you choose from the opposite group. For example, if a patient was started on ACE inhibitors or ARBs, you add on calcium channel blockers. And vice versa, if somebody was started on calcium channel blockers, you add in ACE inhibitors or ARBs. If another medication is required, you add in thiazide-like diuretics such as indapamide or bendroflumethiazide. If further treatment is required, you may choose spironolactone to be the 4th drug. At this point, your GP may consider referring you to the hospital for further investigations and to rule out any other causes for high blood pressure. So, what are the different types of medication that are used? ACE inhibitors, as they are commonly called, angiotensin converting enzyme inhibitors. The common examples are enalapril, lisinopril, perindopril, or ramipril. How do they work? They work by reducing a chemical called angiotensin 2. This chemical tends to narrow the blood vessels, and if this is reduced, the blood vessels relax and widen and you don't have high blood pressure. One of the most common side effects of ACE inhibitors is an irritating cough. Patients who are started on ACE inhibitors requires a regular monitoring of their kidney functions, and you may be asked to have a blood test in 2 to 3 weeks time after starting the medication, or whenever your doctor chooses to change the dose of medication. The other group is angiotensin receptor blockers. The common examples of this are candesartan, irbesartan, losartan, valsartan, and olmesartan. Again, you would require a monitoring of the kidney functions whenever you are started, or if the dose is changed for these medications. You may be required to do a blood test in 2 to 3 weeks time. They work along the same pathway as the ACE inhibitors by blocking the effect of angiotensin 2 on the blood vessels. That is why these cannot be given in conjunction with ACE inhibitors. In other words, They cannot be given together. The most common side effects for ARBs is dizziness. Calcium channel blockers. Common examples of these include amlodipine, felodipine, and nifedipine. There are some other ones such as diltiazem and verapamil. Calcium channel blockers work by affecting the way in which calcium is utilized in the blood and heart muscles. This has a relaxing effect on the blood vessels. The most common side effects of calcium channel blockers are dizziness, sometimes facial flushing, very commonly swollen ankles, and constipation has been reported. Diuretics, or commonly known as water tablets. They are used to treat blood pressure. Diuretics or water tablets, they work by increasing the amount of salt and fluid that you pass in your urine. This has some effect on the circulating fluid inside your blood vessels and hence reducing blood pressure. Also, it has independent relaxing effect on the blood vessels, which again reduces the pressure inside your blood vessels. The most common water tablets are thiazide type diuretics. They include the bendroflumethiazide or indapamide. Spironolactone is another stronger water tablet. Sometimes it is used as an add-on when the blood pressure cannot be controlled with 3 medications. You may require a monitoring of your kidney functions. The most common side effect of water tablets is gout attacks in small number of users, and those who already have gout may report worsening of the gout. Erectile dysfunction has also been reported in certain users. The next group of drugs are alpha and beta blockers. Beta blockers include medicines such as atenolol, bisoprolol, carvedilol, metoprolol, or propranolol. They work by slowing the heart rate down and reducing the force of the heart. These actions lower the blood pressure. These medications have fallen off the favorite list as they were before due to recent emerging evidence, and hence they are not used as the first line. However, in certain individuals, those with cardiac problems, it may be started as a first line. The most common side effects of beta blockers include cold hands, feet, sometimes a poor sleep, tiredness, and impotence has been reported in certain users. Remember, patients who have asthma or COPD should not be using beta blockers for blood pressure. Thank you very much.